Hi, good afternoon. My name is Joyce Herco. I'm the Chief Operating Officer at Regenstrief, and I am thrilled and excited to introduce Dr. Virginia Caine. Dr. Caine is the Director and Chief Medical Officer of the Marion County Public Health Department. She's an Associate Professor of Medicine at the IU School of Medicine Infectious Diseases Division. Dr. Caine is a graduate of the New York Upstate Medical Center in Syracuse, New York. She did her internal medicine residency at the University of Cincinnati College of Medicine and was an infectious diseases fellow at the University of Washington in Seattle. So I'm going to tell you now, I have like 6 pages of things I could tell you about Dr. Caine. So I'm just going to give you a few highlights. Because we know that we want her to have plenty of time to talk and for you all to ask questions. She was recently named president of the National Medical Association, and the National Medical Association was founded in 1895, and it has been a leading force for change within American healthcare, particularly regarding racial and racist health disparities. She's a member of the Federal Committee of the Centers for Disease Control and Prevention, Board of Scientific Counselors, Deputy Director of Infectious Diseases. In 2018, she was named a bicentennial professor here on the IU campus. And the following year, in 2019, she received the Gerald Bebko Community Medallion in honor of her 30+ years of exemplary application of research to critical public health problems. Okay, just one more page, okay? I know, she's limiting me here. Dr. Caine's the co-director of the Indianapolis Healthy Babies Initiative, and she works with community leaders to reduce the African American infant mortality rate, and it's at our lowest in history currently. In her HIV and AIDS work, this is fascinating. Dr. Caine created the first nationwide AIDS physician education program for the National Medical Association, a program that was later duplicated by the American Medical Association. Locally, she established the first countrywide HIV/AIDS integrated healthcare delivery system involving major hospitals, community health centers, and social service agencies, as well as the first HIV dental clinic. She launched a safe syringe access and support program to help reduce the transmission of hepatitis C and HIV. With unanimous support from the Indianapolis City Council, Marion County was the first syringe exchange program that was created. So there are tons more awards, including 2 Sagamore Awards. Look, she's not even listening. 2 Sagamore Awards.
I sound on my phones. Every time I get an email, it dings, sorry.
That's okay. Sagamore Awards are the highest award that the governor of Indiana awards. And she's also received the BioCrossroads Gus Watanabe Life Sciences Champion. So many more things that you're doing and awarded, but we're just thrilled to have her here. And in her many responsibilities, she also serves as a board member of Regenstrief. So Dr. Caine, thank you.
So thank you. I got a whole ton of slides. I'm not going to be able to reach all of them, but I just want to get a little flavor of what's happening from a health disparity standpoint in Marion County. And I'm just so honored and delighted to have this opportunity to speak to all of you, and just look forward to any of you who may be interested in doing some partnerships or some research endeavors related to your fields. If there are any of us that are any of our core services, we're happy to collaborate and happy to work with you. I will announce this. Initially, the health department will be awarding $10 billion next year in terms of any projects related to our core services in the health department. And we're looking to probably add an additional $2 million above that based on our recent community health assessment priorities that got identified. There are going to be 4 tiers of funding. The first tier is less than $25,000 proposals. Second tier, $25,000 to $75,000 proposals. Third tier is $75,000 to $300,000. And the fourth tier are proposals over $300,000. Now we're putting in $4 million in the tier that says greater than $300,000. The tier from 75 to 300,000, I believe we're putting in $2 million in that tier. And then for the rest of the 10 million, I believe $1 million in our first tier and $1 million in the second tier. And so, but they are related to our core services. And so if you go to our website, Indiana Health First, it will show you those areas of what you can do a research project on. It can come from a academic institution such as Regenstrief Institute. Multiple people can apply, but the deadline, here's the deadline, is November the 18th. It's not going to be some really elaborate research document that you will have to send me, except for those who are maybe over $300,000. I got to have a little better understanding of what you want the money for. Now, someone called me last week and wanted to ask about their $1 million project that they were submitting to me. Let me just say, I've got the whole community submitting projects to us. So I doubt very seriously we will fund any entity for $1 million because we want to share the wealth. But there's a possibility somewhere between $300,000 and $500,000 we may look at funding. This is only for 1 year funding. It has to be spent in the year 25. It will be awarded in January, and you have till the end of December in order to do the project. So this is only a 1 year project, and our goal is to spend at least 90% of those dollars. And if we look like you're slow, don't look like you're going to spend all that money, don't be surprised if we grab it for you to give it to somebody else who can spend that money. Because the state legislators who gave us this money is looking to see that we can spend it 80 or 90% of the funds that we receive. And how they look at it, because they got $1 billion deficit now, they'll say, well, you didn't spend it, obviously you didn't need it. So this is the only amount you would get for whatever didn't get spent in the year of 25. We hope to make our decisions by December the 18th, so you will know about it, so you can start posting or applying for positions. But I do have to tell you this, and this is a problem with academic institutions. Whatever we post or whatever we award, that contract has to be posted for at least 1 month before you can start the operations. So y'all need to have a fast process between your contract folks and our ability to give you money, because you don't want the money coming in March and you only have 6 or 8 months to do the project. So be thinking about that. Okay, thank you. So I wanted to talk about the health factors of Marion County and what are some critical issues here. The percentage of adult smokers in 2021 showed that Marion County was smoking at 20%, the state of Indiana 18%, and the United States at 15%. But clearly, if you look at our adult obesity, we are at 37%. Indiana's 37%, and the United States is at 34%. Part of our issue is we have a lot of physical inactivity. You know, we're not doing the activity as we should, whether it's in some of those communities that don't have sidewalks, or people from a poverty level can't afford to belong to a club like the clubs out there, that we do have the Boys and Girls Club for some areas of poverty, but we really have to look at our communities as a whole. Now, excessive drinking, we're at 17%, 18%. Indiana, United States, 18%. Hey, we may be drinking more because Indiana University for football got ranked number, I think we got ranked number 8. Is that correct? An incredible. Okay, all we got to do is beat Ohio State coming up, and we'll be in the national championship finals. Okay. But one of the things that we do have that is an issue in our community is sexually transmitted infections. And with 1,102.7, we have a high population density here. And so our numbers are really high. And we're actually having a syphilis outbreak in Marion County in the last 2 years associated with some congenital syphilis cases. And we're averaging about 28 congenital syphilis cases that are occurring here. So this is something that we didn't see at the beginning of the pandemic. We had no congenital syphilis cases in Marion County. And since the pandemic and the influx of a number of refugees in our community, I believe maybe almost 40% of the congenital syphilis cases may be from Haiti refugees. And we have a slight problem here. So the World Health Organization has different standards of treatment. It's not as strict as in the United States. So a number of these individuals could have been treated in their country, but because they don't meet the United States standards, they have to be classified as a case. And as you know, if you don't speak the language, it's bad enough for us to navigate the healthcare system speaking English. What about someone who's in our communities and they can't speak the language and trying to access services? We still have a high teen birth rate at 28, Indiana 20, United States 17. Now, this is just highlighting on the slide, those slides that are in the really dark black have the worst obesity. So you may recognize some of your counties. And as you can see, Marion County, we're sort of like a little in the lighter blue and not the dark blue, but still no surprise when you look at our physical inactivity, we're not there where we need to be. Now, I just want to highlight this because I want to show you Cook County, which is Chicago. How do we fare? So when you saw that our smoking rates were at 20% for Indianapolis, and Chicago's 13%, their adult smoking rates. So they're 7% lower than us. You know, how is that possible? Okay, that they have better smoking rates significantly than us. And then when you look at the obesity level, we were at 37%, and as you can see in Chicago, their rate is 31%. They still seem to have almost the same level of physical inactivity, which is 27%. I think ours was at 28%. And at 18%, it's a little bit higher. So I don't know what's going on in Chicago. I mean, Northwestern and all those teams are not that great. So I couldn't figure that one out. But if you look at the sexually transmitted infections, remember, this is at 764, and our rate was over 1,000. And even our teen births was much higher, and theirs is lower than us. So just to tell you, when we look at our challenges in Indiana, we do have rising deaths from drugs, alcohol, and suicide. Our rising rates of adult and child obesity is significant. We have persistently high rates of adult tobacco and teen vaping. And from an infectious disease standpoint, we're noticing a high rate of drug-resistant disease agents and infectious diseases. Because of our influx of different people from other countries, we are seeing a high rate of tuberculosis in our communities. And you have to understand that we're very concerned about seeing drug-resistant tuberculosis. And because of the drug-resistant tuberculosis, that means you have to get a infusion antibiotic for at least 9 months. So whether you're in a hospital system or you can get a infusion antibiotics every day, we are very concerned about drug-resistant TB, and we need to jump on that with people who've been exposed, as well as getting them treated immediately. So if they have a positive skin test or blood test, up to 10% within 2 years will convert into an active tuberculosis case. And so very critical areas that we have to be concerned about. And then, of course, we do have the chronic diseases associated with cancer. Cancer and heart disease remains our #1 killer here. And so when we looked at our public health funding before we received this ton of money from our state legislators, the revenue of all of our 94 local health departments was below the national 25th percentile. And so we were one of the lowest in terms of public health funding compared to the Midwest. Our public health funding for our employees was less than the state of Kentucky, less than the state of Ohio, less than the state of Illinois, less than the state of Wisconsin. So in the Midwest, our employees were paid the less compared to anybody else. And I can say that when we look at the Marion County Public Health Department, we first had our first market adjustment of our salaries in 15 years. Liz, you can vouch for that, right? Okay. She's a little epidemiologist, so. But in 15 years, we had not had a market adjustment of our salaries. And so very difficult in order to continue to work. Let's see. So we continue to have high prevalence of cigarette smoking, occupational fatality rate, high prevalence of multiple chronic conditions. And when we looked at this data at that time, we ranked in a number of issues in the top 5 areas. Smoking and tobacco in the top 10 with worse numbers, obesity, mental health, and childhood immunizations. So let me just go on here. Okay. So when we look at the mental health landscape, when we did our community health assessment, the #1 issue that popped up with the highest number was mental health. So a lot of anxiety, depression. And so 22% of our adults live with some type of mental illness, 1 in 4. 51% state that even though they have a diagnosis of mental illness, they did not receive treatment. And 13% are uninsured, so it's difficult to get access to care if you have no insurance. But 39% report having an unmet need despite everything. 6% of our adults had serious thoughts of suicide, but we're also seeing our suicide rates go up in our young adolescent population. And so 11% live with severe major depressive episodes, but 56% of our youth with a major depressive episode did not receive mental health services, okay? So you can understand sometimes occasionally about these shootings in schools where someone will just, go cocked off in a sense and shoot other individuals in the classrooms. We have to address the mental health issues, but we have to capture it from a screening at an earlier age. People think it's the kids that act out are the ones we have to worry about, and sometimes it's the quiet ones who don't say anything or do anything. So We have to have the skill sets in those classrooms to be able to identify when these children need help. And even when they need help and school personnel are telling them they need help, a lot of parents refuse, even people of color definitely refuse to get those services because they're concerned that, well, my child will be labeled as a mental health problem. This will carry him all through school and it will impact his grades. There's nothing wrong with my kid. I'm not going to let you label my kid like this. And so it's unfortunate that a lot of them don't know they can get that mental health treatment, and that's nobody's business but them and their doctor. That's private HIPAA information. They do not have to report it to the school system, but unfortunately, a lot of them don't realize that. When we look at heart disease, we see a much higher rate of heart disease still in Indiana compared to the United States, both males and females. Cancer is the same way. Invasive cancer mortality is higher in males than females in the state of Indiana compared to the United States. And I thought this might be of interest to you. It's a busy slide. Sorry about this, but it's maybe important so that when we look at all the causes of death in Marion County, cancer is number one for the total population, with heart disease being number two. And yet, heart disease nationwide is the number one killer, followed by accidents, unintentional injuries, and then chronic lower respiratory diseases, number four, and strokes, number five. Now, if we break it down by males, though, looking at the top five causes of death in Indianapolis, number one cause of death for the males is heart disease. But for the female, look on the far left, my far left, your far right. The number one cause of death in females is cancer, with heart disease being number two. But for the male, heart disease is number one, cancer is number two, the accidents, unintentional injuries are number three, chronic lower respiratory diseases is number four. But look at for the males in Marion County, homicides make up our fifth leading cause for males in Marion County. But it is strokes if you are a female in Marion County. Now, I will say that if you're white, a male, the number one cause of death is heart disease, cancer second, accidental, unintentional injuries, chronic lower respiratory diseases, and strokes if you are the white male for cause of death. But if you are the black male in Marion County, homicides is the fourth leading cause of death, with heart disease being number one. But look at the accidents, unintentional injuries for the black male in Marion County being number two. And if you go to the black female, I want to address your attention that the fifth leading cause is Alzheimer's disease for the black female of all of the groups, with cancer number one, heart disease number two, accidents number three, strokes number four, Alzheimer's disease number five. Okay, all right. Part of our issue is the poverty level, which translates in lack of insurance and not having the ability to access health care. We continue to have very high rates of poverty for our Blacks in the state of Indiana. Native Americans is 20%, Asians 20%, Pacific Islanders is 24%, with our Latinos at 25%. So a much greater widening of our gap of disparities since the pandemic. I think I'm going to see. And so this is just of interest. If you look at our social environmental maps by poverty, you can see that most of the poverty levels are in the lower southeastern states
And also you can see like the Arizona areas down there where there's a extreme amount of poverty, but we have pockets of it here in Indiana. And then when you look at the unemployment, you can see that Indiana does a pretty good job. You see that we have very low unemployment rates when you look at the state of Indiana compared to all these other states nationwide. And then when you look at it from a health insurance standpoint, though, without health insurance, we still do fairly decently, but still have greater pockets of individuals without health insurance in the state of Indiana. Now, I do want to talk about maternal mortality because that's got a lot of our attention. And at some point, Indiana was ranked in the top 10 for maternal mortality. And so, and they have different definitions: pregnancy-associated death, pregnancy-related death. Um, uh, that one pregnancy-associated death that you just die, it doesn't matter what the cause is, it's not necessarily related to your pregnancy. You might have been in a car accident and you die. But the pregnancy-related death is the one we're the most interested in because there are things that we have to do from a healthcare system and quality standpoint in terms of making the diagnosis. So we saw that in 2022, that if you were Black, that you had about a 3 times the rate compared to a white female for the maternal mortality rates. And part of that is associated with lack of getting into care in the first trimester to identify that you have a problem. But we also, because of obesity, sometimes may be at a higher risk for hypertension or diabetes that needs to be managed early in the pregnancy that may not be picked up. And I'm a tennis freak. I can't play tennis, but I love to watch it. And I think most of you have heard of the story of Serena Williams when she was in a famous hospital. And believe it or not, in California, I thought she would be in New York, but it wasn't. In California, I guess she was her home was in Florida though. And so she complained of being short of breath and wanted to have it checked out. Large hospitals like that, they have residents. So they sent in a resident to examine her, and he took a listen to her lungs and told her he didn't hear anything and whatever, and that she was okay, not a problem. And she says, no, I think you can do better than that. I'm short of breath and I know something is wrong. So he orders a chest x-ray, and she gets the chest x-ray. She didn't say anything. And he comes back and tell her, see, your chest x-ray is negative. There's nothing you need to worry about. So, sometimes, people getting anxious being pregnant here from anxiety. And I think that's what's contributing to your shortness of breath. So he leaves the room. She calls her manager and tells her manager, get me out of this hospital. She calls the nurse to say, I need to pack up my stuff. Can you bring me my clothes and everything? The nurse said, well, what's going on? She said, I'm not going to die in this hospital. So, of course, the nurse being very astute, I think she's worth now about $500 million. So I think they called whoever they called the nurse in charge, and they actually called the president of the hospital. And they got the chief of OBGYN of that hospital to come in and see her, got him there within the hour. And he says, what's wrong? I don't understand why you're leaving. Because she says, because you guys are trying to kill me and you're dismissing me and you don't take me seriously. He says, I don't understand. She says, any dumb person would know if you've already had a deep vein thrombosis that a chest x-ray doesn't pick up a pulmonary embolus, only a CT scan. But he comes in here trying to assure me by getting a chest x-ray, I'm supposed to accept that and think I'm okay. I know I'm definitely short of breath, and you haven't even provided me even close to the quality of care They got that CT scan within 30 minutes, and guess what? She had a pulmonary embolus, and she could have died that night if she had not been placed on the appropriate treatment. But now you have to think about it. How often is it that people of color, low poverty level, know that something may not be right, and they argue with their healthcare providers, healthcare professionals, and it doesn't get the response that they think they should get. I say that, okay. So I don't care about each and every one of you. I have some colleagues that may not always listen from a healthcare professional standpoint. You may have some of your faculty or your students who don't always listen sometimes when they should. So this can happen to anybody, any career, any profession, but we just have to continue to try to improve our quality of care and services that we have. So our rates are higher, though, the maternal mortality, if you're over the age of 40 and you have your baby. So the younger you are, under 25, is associated with less mortality. When we look at it in terms of who gets into the first trimester of care, and you got to get in, you have to have at least 7 prenatal visits in order to have a healthy outcome. And you got to get in the first trimester. So you start those prenatal vitamins, they don't work if you wait to start them, at the end of the pregnancy. So 80% of white pregnant mothers get in the first trimester. Look at that low drop of 56% for Black females. The Hispanic females get in the lowest at 45.9%, but they got a secret that I'm going to tell you about a little bit later, why they have a much better health outcome from a mortality standpoint for infant mortality than their Black counterpart, even though they're the lowest getting in the first trimester. And as you can see, overall, our rate is 62% for Marion County and 74% for the state of Indiana. And the national average is 78% for the United States. So when we look at smoking, our highest rate of smoking is in our white pregnant mother at 8.4%. Our overall smoking in pregnant mothers is 5.8%. So you see we do better in Marion County than the state of Indiana at 9.8%. And then our Black female pregnant mothers are smoking at 4.6%, and our Latino mothers at 4.2%. And that national average of the United States is 4.6%. So we're getting there for smoking in pregnancy. The goal for 2030 is that no more than 4% of pregnant mothers should smoke. And we're at 5.8%. So we're closer to our goal in Marion County. Now, here's the secret. Mothers who breastfeed, because they provide just maternal antibodies, they prevent that person, if someone is breastfed, they have a much lower risk for developing obesity at a later age. But it also takes care of reducing their risk for like asthma. It helps cut down any infections because they got mother's maternal antibodies when they breastfeed. So when you look at the breastfeeding rates, who's got the highest breastfeeding rates of all the race and ethnic groups? That is our Hispanic Latino mother at 91%. They are already meeting the 2030 goal. Greater than 90% of their mothers breastfeed. And so that's why they have a better infant mortality rate than their Black counterparts. Our white mothers breastfeed at 86%. Our Black mothers breastfeed at 83%. And Indiana's overall breastfeeding is sorry, that should have been 81%. Sorry about that. 81% for Indiana. United States is 83.3%. And for all races for Marion County, that should be 86%. Now, just want to highlight some things about what has happened with the COVID-19, just to highlight to you that in all of the COVID cases, all the way through the end of March of 2023, when we looked at our COVID-19 cases, Indianapolis had the lowest number of COVID-19 cases in the Midwest compared to any other the cities at 6.5. And so Chicago's cases were 12.3 per 100,000. Detroit, Cleveland, 13, 12.7. Dayton, 12.4. Columbus, Ohio, 8.9. Anybody here from Louisville, Lexington? Okay, so I can say this, all right. Okay. So they may have had the highest rates at 17.9 COVID cases in Louisville, Lexington 14.8, Milwaukee at 10.8. And I say this to say that we had an incredible collaboration of COVID-19 with all of our healthcare systems, where we met on a weekly basis. We made decisions together. We worked close in hands with our State Department of Health, so that I feel because of the work done here, we had a tremendous mayor who believed in the science, able to make those recommendations in our school systems, as well as for our businesses, providing safeguards. And when we all said and done, we had the highest number of cases in the white population, followed by the Hispanic Latino population, then the Black COVID-19 cases, and our Asian population with the lowest. And it was no surprise that when you looked at it by race and ethnicity, we still had significant cases based on gender, with the green representing the males and the blue representing the females of the number of COVID-19 cases. A lot of times you saw a greater amount of COVID-19 cases because you had males in more jobs out there being exposed at a higher exposure rate compared to their female counterparts. But when we looked at the deaths rates, we saw that the highest death rate was in our white population, followed by the Blacks, with almost twice the death rate in Blacks compared to our Latino population, with our Asian population having the lowest. But I'm going to tell you that why we saw such low rates of deaths in our Hispanic and Asian populations, these numbers there is going to be revealed that they had the highest vaccination rates in those particular populations, that I think provided them a lot of safeguards. And despite that, Blacks had the highest hospitalization rates compared to any other race. But when you looked at the vaccination rates, now, while this is busy, I'm going to tell you that in the 25 to 44 year of age, that 80% that red there, that represents the Latino population. So 86% of Latinos between the ages of 25 to 44 had the highest vaccination rate, followed by the Asian at 68%, our white population at 56%, with the Black being the lowest at 39%. Okay, now look at the 45 to 64 years of age. That 92% represents the Hispanic population who got vaccinated with COVID-19 from 45 to 64, followed by our Asian population at 77%, our white population at 64%, and 64 being our Blacks. So next, real quickly, we've seen a significant amount of violence in our communities, In 2022, we reported 210 homicides. But that was a 15% decrease from 249 homicides in 2021. And so, but over 80% of our homicides are firearms related. But when we look at it, what age groups? So 20 to 24-year-olds was the highest groups dying from homicides with firearms. But guess who's the next group that's the next highest? Is our 15 to 19-year-olds who are the most likely to die by homicides in Marion County. And this just highlights, oh, sorry, I went too fast here. Let me see. Sorry. This just highlights that look at the tall group of homicide deaths per 100,000 if you were in the age group from 18 to 24. And then the next group is 25 to 34, 35 to 44. So we need to be able to stop these deaths based on that age group and look at the Black homicide deaths compared to their white counterparts. We're almost 6 to 8 times higher of our homicides occurring in this community with our Black population. And the males are much more higher than females, and sometimes a lot of the female homicides deaths are related to they were in the wrong place at the wrong time when somebody was shooting them. So we don't have as many females actually getting a gun and killing folks. It's more in a situation that someone is shooting into the house or the apartment, or they're in the car with somebody, and they don't care who's in that car. In terms of trying to shoot somebody, they're shooting them. And so, so I just want to point the fact that although in 2022, and this is just for 6 months, remember, there were 248 homicides in 2022. We saw much lesser homicides back prior to the pandemic. So just remember that gunshot wounds are the leading cause of deaths in Americans younger than 19 years of age. And then that this has increased almost 50% in the last 6 years, with more than 60 Indianapolis juveniles surviving their wounds in 2023. I'm just telling you about the ones who died, but 60 of them got shot and they survived. And 14% of them, by Dr. McGee, stated they've been shot and survived on more than one occasion. So we've seen a dramatic decrease so far in 2024, but it's those accidental deaths that are so heartbreaking, where people don't, they have these loaded guns. We had a young teenage boy, I can tell you this one because it was not in Marion County, in Gary, Indiana, was babysitting his 3-year-old sibling. And he's one of those guys that I'm told that, you know, when you walk, they have the pants down, look like it's going to fall off or whatever. And so I guess he had his loaded gun in his pants and he was on the couch. His mother left to go and pick up a prescription in the from the drugstore. She was going to be gone about maybe 20, 30 minutes at the most. He was on the couch with the loaded gun in his pants, and it must have fallen on the couch. So he's going to the bathroom. Next thing he knows, he hears a gunshot. And he comes out to find out that his young 3-year-old brother had shot himself in the head. Now, he's smart enough to call 911, and they were able to get there before his brother died and was blood everywhere. But his brother did not survive because the gun fell in the couch. And these kids, oh my goodness, I hate to say this, and I'm aging myself. These kids are so smart, so bright. Even at 2, 3, they can find anything. People put guns under their mattresses. They can find them in their drawers. They think they can put them on top of the ceiling of their closets, top of the refrigerators. If you don't have a gun lock or storage box, it's deadly. And a lot of folks don't want to use a gun lock or storage box. They feel that they can't get it open in time if someone is breaking into their house. So we have a lot of help that we have to do. So chronic diseases, obesity. Our obesity goal is 36%. You know, we're at 37%, but guys, we got way much work. Our goal should be way lower than the 36%. And so in the United States, it was 28% in 2011. It's already 34%. And just to look how we look and compare to other states. Well, Arkansas, West Virginia, Mississippi have the highest rates of obesity at greater than 45%. But we are in that next tier of greater than 35%. So Ohio, Indiana, Illinois, Michigan, all that Midwest corridor, we have much higher rates. And so the places like Texas, Montana, Wyoming, Idaho, they have an advantage over us. You got to go the distance to find anybody in those states, okay? You got to walk like nobody's business, even to get to the grocery store. So we don't have that luxury here in the state of Indiana. So I don't know what we're going to do. And no surprise that Indiana rate is higher in the female at 38.7 for Indiana compared to the national average of 34%. And we're almost comparable in the male for obesity in Indiana compared to the United States. And so I'm just going to go through those right quick. Okay. So let's see. So when we break it down by race, the black is in the gray, the white's the dark navy blue, Asian is the darkest green, with the lighter green being Hispanic. You can see on the total side there that the lowest obesity rate is in our Asian population is 17.4, with our next group being white at 42.2%, with the highest obesity in the United States being nearly 50% for blacks. And listen, well, that's in the United States data. The African-American black female has the highest obesity rate of everybody, and we're at about 58% for our obesity rate in the country. And so just want you to know, we're one of the 23 states that 1 in 3 adults has obesity. Just see here, let me go on. So, and this is self-reported, but I think most people are honest about their weight. But you can see Illinois and Michigan are doing better than Indiana, Ohio for obesity. Now, if we looked at black adults, you will see that, wow, in the southeastern area, there's a heavy rate of obesity compared to Indiana. So tobacco use, in 2022, 16% of Hoosier adults reported currently smoking. And now, while we've declined significantly in 2011, we are higher than the national average of 14%. And when you look at e-cigarette use, 8% of our adults were using e-cigarette uses. So we're higher than the national average in Indiana compared nationally at 7.7%. And folks still love their smokeless tobacco use. 3.4% of Indiana adults reported use of smokeless tobacco. Okay. And so when we looked at Indianapolis, our smoking rates went from 27% in 2011. We're down to 16% now for Marion County for smoking. And of course, Indiana still ranks 10th highest in the United States for overall smoking. So we both have declined, but still a work in progress. And the largest group of age group using the e-cigarettes are 18 to 24-year-olds are the highest. HIV, real quickly, we have 2020, we were doing remarkable well. We dropped from 2019, just as the start of the pandemic, down to 17.1 cases per 100,000. But as you will see, from 2021, 22, we were starting to see an increase. In 2023, we hit 28.1. So we've been seeing a little explosion, not only of the syphilis, but the HIV has coincided at the same time. And when we look at it based on gender, of course, the male is at a much higher rate than their female counterparts. And when we look at it by race, in 2023, the dark blue cases, the highest was in our African Americans who are Black, followed by our other Latino group who has the second number of HIV cases, and then the lowest being the white number of incidence cases of HIV, followed by the Asian at the most. So the Black consists of people from Africa, and it consists of people from the Caribbeans and other countries. So we're finding that the majority of these newer HIV cases are people who are recent immigrants into our community that are contributing also to our rate of HIV cases. And so based on the age group, we're still seeing a significant number under the age of 15, with the highest age group between the 20 to the 24-year-olds, followed by the 25 to 34-year-olds. But I do want to say, look at that 65 and older. If you didn't know it, I'm going to help you out here. People over the age of 65 is still having sex, okay? And so for some of them, they are getting, there were a little over 20 some cases per 100,000 in that group acquiring HIV. And we do see that the MSMs, men having sex with other males, is a major contributing source to our new HIV cases, followed by, we're almost having the same heterosexual population outbreak that's taking place also with our HIV, with a much lower rate of IV drug use, but still present. So just to let you know, in 2022, there's more than 2.5 million cases of syphilis, gonorrhea, and chlamydia were reported in the United States. And so that's of significance to all of us. And so this uptick in congenital syphilis is the same happening across the nation. Some of it that's driving it is injection drug use. People, you know, when they're high on drugs, they're more likely to be uninhibited in terms of who their partners are and the sex. And we can see that a lot of them reported methamphetamine, 10% injection drug use, cocaine, heroin, and crack. So when we broke it down by the primary and secondary syphilis, the higher rates were in our white population, followed by Hispanics, with Blacks being the lowest. So I'm going to just move on here. Substance use, we've been seeing an alarming increase in overdoses in the big cities. Opioids have contributed to it, stimulants, and this is a busy slide, but you will see Minneapolis, San Francisco, Seattle, Washington, D.C., Chicago have had very much high rates of overdose deaths. And look at our visits. Our highest have been in whites. We had 756.7 visits per 100,000, followed by our Black overdose ED visits at 633, with our Hispanic at about half that rate of 307. So although we've been seeing a decline recently, it's still a major problem, and we worry about Narcan. And still, 15 to 24-year-olds are having overdoses that we are seeing, as well as less than 15-year-olds having the overdoses. But what's heartbreaking are the deaths. 27% of the accidental overdose deaths in Marion County was the highest in 40 to 49-year-olds, followed by 30 to 39, 20 to 29. But look at 10 of them died between the ages of 13 to 19. Diabetes, because of our obesity, nationwide, we're at 10.8%. Indiana, as high as 13.2% for Marion County for our diabetes rate. And so I tell you what, I'll stop here and just ask questions. Anybody want to ask me questions? But I'll have the slide deck that you can look at the data that have other things that are on it. I got high cancer rates. HPV rates are higher in our Latino community in Marion County in the state of Indiana compared to lung cancer.
Thank you, Dr. Caine. I know you have a 1 o'clock appointment, so we want to thank you. A question about the
Can I
slide.
just answer? I mean, that can be quick. So anyone have like 2 or 3 questions? You might even want to ask me about the grant funding or whatever.
I had a question. It's Andrew Gonzalez. Are we collecting any data statewide with regard to racial disparities in amputation rates?
And who?
Amputation rates,
So
lower
that
extremity
data,
amputation?
so that data should be collected about amputations in the hospital systems. They're required to capture demographic data in the hospitals so that, and let me just introduce you to Elizabeth Bowman over here in the corner, who's our Director of Epidemiology. So that should be by hospital code, and it should be accessible.
Hi, Dr. Caine. I'm Jill Understrode. I'm an assistant professor here and with Center for Biomedical Informatics. So when you're talking about the maternal mortality data, is there any effort or any coordination between Marion County and Indiana Department of Health to about retention and attraction of OBGYNs? Because I know that with Indiana's abortion ban, we are having trouble retaining. Are there any kind of efforts?
So I
underway?
know that we've had discussions with the State Department of Health related to trying to recruit and retain OBGYN providers. We've even talked to IU, and it's a tough sale. So a lot of our fairly qualified community health centers are looking for OBGYN, and the problem comes with how much their liability is costing them. But they are more concerned about getting a lawsuit and being threatened with that. And so there are states that are much, much more favorable. So it's kind of difficult. So we've still been trying to brainstorm about that. Yes, I think he's got one.
And thank you for your talk. I was going to ask you just about the grant application.
Yes.
I've been working with the housing and neighborhood sort of health office with a team within your office, within your department. And I was wondering if the proposed activity can partly involve something internal to your.
So we know that $2 million, that's not in that $10 million that goes with our core services. One of the 5 priorities that popped up from our community health assessment was related to safe housing. So anything along that lines, mental health, because it's the function of the Division of Family Social Services. It's not through the State Department of Health. You don't see that on the list, about $10 million, but we're going to use at least probably $1 million from my general funds to try to address something like that. So you got some wonderful ideas you think that might be ideal. Talk to us first before you submit your application. We could tell you about it, and I think it'll fly. Yes, uh-huh. There's a microphone right there.
So the slide, I think it was probably the last slide about diabetes.
Yes,
Was that type 2? Was it all? Was it type 1, type 2, just type 2?
I think it's just type 2.
Okay,
Okay.
I was just curious. That's all. Thank you.
Liz, am I right about that? Yes. So blame Liz if I got anything wrong with the statistics, okay? And I do want to thank her staff and everything to help with that data. We're fortunate, we have Indiana Health Information Exchange here where we capture a lot of data, and because Regenstrief Institute is known as the Informatics Center reputation, we have a lot of access to data that we can pull, and all of our hospital systems and the Indiana hospital system are very good about allowing us to see emergency room data or even hospital data. So if you have something of interest and you like to find out information related to that, we might be able to provide assistance for you.